This week in Health and Science News, a man in California who hates big pharmacies goes into a Walgreens and shoots a worker. The man went into the Walgreens, shot out a camera. The worker died in the store while he was sheltering in place. Next up, over 350,000 health workers are facing deportation risk. Immigrants, both documented and undocumented, play a very critical role in our healthcare system. More than 1 million non-citizen immigrants work in healthcare, and a third of them are undocumented. Deportations could significantly affect long-term care, where immigrants play a key role. The resulting shortages could be devastating. 23 states and DC are suing the Trump administration over billions of dollars lost in public health funding. This was in response to the $12 billion in public health funding that was suddenly rolled back by HHS. HHS replied that it refuses to waste billions of tax dollars on a non-existent pandemic for COVID-19. A little while ago, Trump signed an executive order requiring hospitals to reveal the prices that are negotiated between insurance carriers and hospitals. Now, when I initially saw this come up, I thought, cool. Trump tried to do this during his first presidency with an executive order. And back in 2021, the hospital price transparency rule went into effect, which required hospitals to post on their websites machine-readable files and a consumer-friendly display. The rollout of this has been a crapshoot, with many hospitals only placing machine-readable files on their websites. Consumers still do not have access to this information, and this executive order might not really do very much. And because there's so much terrible news, I'm going to end on a little bit of a lighter note. Northwestern University engineers have designed the world's smallest pacemaker that is activated by light. The device is so small that it can be inserted with a syringe and then it dissolves after it's no longer needed. It's smaller than a grain of rice, and the pacemaker is paired with like an external device. It's a wearable device that mounts onto the patient's chest, which controls the pacing by detecting an irregular heartbeat and then shining a light to pulse activate the pacemaker. It was really designed for patients who only need temporary pacing because it can dissolve after it's no longer needed. The thought process of this was really for a lot of infants, tiny babies that have heart defects and may need access to a pacemaker, but this is a much less invasive option. That's it for this week. See you next week.